The El Paso Behavioral Health Consortium convened in 2012 to examine El Paso County's behavioral health system in preparation for future service needs and funding trends. Its actions are informed by community leaders and available data, including an El Paso County Behavioral Health System assessment completed in 2014. The 2014 assessment showed the biggest challenges confronting El Paso's behavioral health system were fragmentation and the ongoing need for collaboration among community organizations and agencies. As a result, the Consortium Executive Committee set out to expand its reach. The consortium developed 3 strategic leadership councils to seek out and engage existing individuals and organizations to champion improved communication, coordination, and lasting collaboration.
The El Paso Behavioral Health Consortium is very important for our community, whether it be working in the tri-state area with New Mexico, Texas, and Mexico with Juarez, our sister city. We really do our very best as part of this collaborative to bring all the stakeholders together.
EHN's participation in the consortium is critical in building relationships with key stakeholders, especially in areas such as children's mental health services, jail diversion efforts, and workforce development.
True collaboration requires organizations to exchange information for mutual benefit, alter activities, share resources, and work to enhance each other's capacity to achieve a common purpose. It can take years for such cross-organizational trust to be built.
Improving our behavioral health system is a challenging and complex task, and this is why it's so important to have the dozens of partners in the El Paso Behavioral Health Consortium.
The El Paso Behavioral Health Consortium is a great community collaboration. It brings different agencies together in a purpose of improving mental health services for the El Paso County residents. It's a great way to put away hidden agendas and just bring everything to the table to understand each other's organizational mission and improve services.
The consortium's leadership councils are growing and developing structure, strength, and synergy. Each leadership council works to help organizations and agencies share successes and learning experiences as they make data-informed changes to policy and practices. The Family Leadership Council works with child, adolescent, and family health organizations, other child-serving agencies, and natural support systems to transform El Paso County into a model community for child and family behavioral health services and support.
It's only through ongoing collaboration and long-term commitment that we can achieve comprehensive, person-centered service options that will contribute to the wellness of our community.
The Juvenile Justice Center of El Paso County is fully committed to working in collaboration with the Family Leadership Council of the Paso del Norte Foundation.
The needs assessment conducted by Tri-West highlighted the gaps in our mental health services in El Paso, and the Family Leadership Council has created a collaborative characterized by trust and really good communication, which are critical foundational elements to successfully fulfilling these gaps.
The Justice Leadership Council works with justice system leaders and stakeholders as they transform the current system to support person-centered, recovery-oriented care and treat as many people as possible in healthcare settings instead of within the criminal justice system.
Each consortium partner plays a vital role in building an effective and efficient behavioral health system. The Justice Leadership Council will connect partners in the public safety system to prevent inappropriate confinement and ensure that individuals who have a mental illness are referred with dignity and respect to the behavioral health services they need.
Obviously, in a community with incredible need, there is the equal need for collaboration. Without collaboration, it is virtually impossible to address the gaps and challenges that we have. Here at the county, I'm very proud of the work that we've done with regard to behavioral health as it pertains to criminal justice in particular. Last year, we embarked on a number of reforms that helped transform the way we administer criminal justice and the work that's happening at the jail. One of the things that I'm most proud of is the collaboration that we engaged in with Emergence Health Network. They are now working on the intake at our jail because, as we know only too well, in America, our jails really house many of our mentally ill and many people who could easily have a very different life were they getting the services that they needed. And so our contract with EHN and our collaboration with EHN plays an important role in diversion, in making sure that people are getting access to services and prescriptions that they need. We made other really incredible changes, legislative changes at the state level so that we could have access to 24/7 magistration, so that we are doing the constant intake instead of just 8 to 5. Other incredible reforms that have helped transform the way that we deal with people coming into our jail system, but really, again, most importantly, the way that it impacts those who need access to behavioral health treatment in particular. This upcoming year, our focus will be a little bit different in that we are now going to be looking at reentry and members of our community who are coming out of that system, especially with regard to mental health needs, because the last thing we want is for our jail to be a revolving door for those who need behavioral health services and not criminal justice rehabilitation. So all of this would not have been possible without our internal collaborations with the sheriff, with the judiciary, commissioner's court, administration, and obviously we need the support and assistance from outside collaborators, largely Emergence Health Network and other critical providers, and we will need that future collaboration as we look at reforming the reentry programs and how we re-engage our citizens coming out of those jails with other citizenry and with the community. But many thanks to the Consortium for all of the dialogue that they lead and the conversations that are inclusive of every party in this community. We're very proud of the work that we've done at the county. We look forward to continuing it, and we look forward to continuing the dialogue with you.
Addressing behavioral health needs is one of the most important issues facing our community today. It requires collaboration across many partners, not only in governmental entities, but nonprofits, educational institutions, medical institutions. It's very important that we continue to work together to achieve better outcomes for individuals that have behavioral health issues to better serve our community. Overall, the issue of behavioral health is one of the most underserved issues facing our community. We simply just don't have enough providers. We don't have the services that other Texas communities have. And as a result, there are several hidden costs to this community that a lot of people are just unaware of. So the Behavioral Health Consortium is a very vital component to addressing this need and ensuring that our community is not only just up to par with other communities in Texas, but also leading the way when it comes to new ideas, new partnerships, new ways of thinking, new ways of addressing problems when it comes to behavioral health, and only through partnerships, such as through the Behavioral Health Consortium, are we going to be able to achieve those types of objectives.
The Integration Leadership Council works with healthcare providers to increase access to recovery-oriented behavioral health care by increasing the numbers of available providers and by integrating behavioral health and recovery supports into primary care settings.
Working together to meet our community needs, such as increasing the number of behavioral health providers, not only increases accessibility, but also quality of care to individuals with mental health behavioral disorders and their families. We appreciate the opportunity to collaborate with the consortium in meeting our community's needs.
Centro de Salud Familiar La Fe champions a service philosophy of Nuestro Bienestar. This holistic approach to the well-being of our people we serve is grounded in the belief that health is not dependent on physical well-being alone, but must include the behavioral, economic, and developmental needs of our community. Working collaboratively with the consortium and our community partners is key.
Teamwork is key to helping our community succeed. To quote Kenneth Blanchard, "None of us is as smart as all of us." This is evidenced on a daily with the collaborating efforts of the organizations that Project Vida has worked with in the past several years.
The hospitals of Providence believe in collaboration. We collaborate with our community partners. We believe in collaborating among our own facilities. We believe that as a community, we can come together to address any behavioral health needs we have in our community.
Behavioral health in El Paso is one of the most underrepresented and understaffed issues that we can imagine. Not only is there a lack of providers, there's a lack of facilities, and there's a lack of coordination amongst those facilities. The Paso del Norte Foundation, with establishing this consortium, has taken a tremendous step to allowing us to utilize our meager resources in the most effective way.
The consortium seeks representation from each sector: education, nonprofit, for-profit, government, community advocate, federally qualified health centers, hospital systems, and others.
Thanks to the consortium, we now know the specific needs for mental health care in our community. NAMI El Paso is committed to work with the consortium and its collaborating partners to ensure that our residents and their families receive quality services for mental health conditions in a timely manner with the least amount of barriers.
The El Paso Behavioral Health Consortium is committed to ongoing collaboration where all partners are welcome, empowered, and unified to achieve an inclusive, person-centered behavioral health service and support system. This effort helps to further the Foundation's mission to promote health and prevent disease through leadership in health education, research, and advocacy.
The growing list of consortium partners is forming a sound foundation. With ongoing collaboration, the future looks brighter to meet the behavioral health needs of patients and families in El Paso County.